Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Innovation Compounding, who are a PCAB accredited sterile and non-sterile compounding only pharmacy, licensed to ship throughout the United States. They commit to individualized pharmaceutical care and personalized medicines, compassionate towards patients and doctors, as well as being a wellness advocate for their patients' lives and state of well-being. Call toll-free 800-547-1399 or visit innovationcompounding.com. Today I'm joined by Dr. Tara Thompson, who is a pharmacist from Innovation Compounding in Georgia. Thank you for joining us today, Tara.
Thank you, Linda.
So, first of all, let's find out about you. You know, where did you study? Where did you train? What have you done so far?
Okay. I was born and raised in Texas. My dad is a pharmacist, so I kind of grew up in the pharmacy helping him out even before I was a pharmacy technician, even when I was little, just helping him out odds and ends. And so I really had a love for medicine early on. Once I got to college, I went to Texas A&M for my undergrad in Biomedical Science. I was still interested in the medical field. It was definitely something that I had always loved, and just patient health in general, and how diseases and drugs and everything worked within the body. Also in the animal field, I was really interested in veterinary medicine too. But throughout college, I think my main focus started being around the pharmacology of drugs themselves, so the chemistry and the biology and biochemistry around how drugs worked in the body. I was really interested in that. It came easy to me to kind of understand those pathways and the mechanisms of action. So that's something I kind of honed in on towards the end of my undergraduate degree. And from there, I decided that pharmacy was indeed somewhere I wanted to be, and went to the University of Houston College of Pharmacy and graduated in 2012. So here I am today, 6 years later.
And it says on your bio, other than being Vice President of Clinical Services at Innovation Compounding, that you have done extensive research including female sexual dysfunction, pelvic health, hormone replacement therapy. Would you like to tell us a little bit about that?
Yes, absolutely. So this has really been my first real job as a pharmacist. I've worked here at Innovation for 6 years, ever since I worked here before I graduated. Before I took my pharmacy boards. I had a position here just helping out, and then kind of went from there. But I was mainly brought onto the team at Innovation for women's health. So we were having a lot of big interest in pelvic health and female sexual dysfunction at the time, and still today, but really just needed someone to focus in on that women's health side. And just we do a lot of research behind the drugs that we use in our compounds, and how we're dosing those and putting those combinations together for certain female conditions. So we do a lot of hormone replacement therapy, of course, pelvic health in terms of hypertonic pelvic floor disease, vulvodynia, vestibulodynia, lichens syndromes. We do a lot of interstitial cystitis, really just pelvic pain in general, anorgasmia, hypoactive sexual desire disorder. There's a big realm for that, and that's really where I focus a lot of my attention. And so when it comes to low-dose naltrexone, we certainly compound a large majority of that here at our pharmacy, But looking at it from terms of women's health standpoint, I think it has some really promising places in the female realm as well. So that's kind of how I got to innovation. I did all my training through pharmacy school in Houston at PCCA, which is headquarters is down in Houston. They have a great compounding program there for students, and really just got my love for compounding there in pharmacy school, and came up here and was offered a great opportunity in the women's health field. So I've been here ever since.
Mm-hmm. And what forms do you compound LDN in your pharmacy?
I would say the majority is capsules. We do 0.5 milligram increments, anywhere from 0.5 to about 8 milligrams. Of course, the most popular being a 1.5 and a 4.5 milligram capsule. However, I've kind of started branching off from the capsules because, of the children, the pediatric population, as well as those who are having a hard time swallowing capsules or do not prefer capsules. I really reached out a little bit into the transdermal form of low-dose naltrexone, typically in a transdermal cream of some sort, but also we've really looked highly into emu oil and have found that it's been great to use for patients who are seeking transdermal treatments.
Mm-hmm. I interviewed a pharmacist in Australia, and they always use emu oil. It is
Yes,
a carrier that they use.
it's wonderful. It's a wonderful carrier. It does not have phospholipids, so it's highly penetrable and easily absorbable on the skin. It's non-comedogenic, so that's great for our sensitive skin population, and doesn't leave a residue that we've seen, and very hypoallergenic. We love emu oil. It's definitely a great option, a great carrier for the LDN.
Mm-hmm. And when you compound your capsules, what filler do you use?
We use Avicel, so it is just a microcrystalline cellulose filler. Mm-hmm. It does not have any sort of time-released or sustained-released potential, so we definitely use just an Avicel to form an immediate release mm-hmm. capsule.
And do you ever have the need for sublingual drops?
We do. We've actually done a couple sublingual troches here at our pharmacy. We try to use the molded preps as much as possible because, they're just more palatable and can be flavored and that kind of thing. So we have done some sublingual troches. Mm-hmm. But I'm sure a drop would be equally effective in that sense.
Mm-hmm. And from the patients that your pharmacy has using LDN, what kind of a population have you got, as in condition-wise? Do you know?
Yes. I don't know all of the conditions that we treat, but I do know that we have several patients, just from speaking with them from a counseling standpoint, who are taking LDN for pre- and post-surgical reasons. So if they're going in for some sort of scheduled surgery in the future, we'll have patients taking the LDN to kind of get their immune system boosted and ready for the healing process that will follow that surgery. Mm-hmm. So, breast cancer patients, mastectomy patients, patients who are going in. Like I said, we do a lot of female pelvic health and sexual dysfunction. So we see a lot of surgeries for endometriosis and pelvic reconstruction and that kind of thing. And I've seen these patients using it for those reasons. Also, we have some children who are on LDN from our pharmacy for autism. Mm-hmm. So I know that there's a link there between, immune system regulation and the low glutathione levels. So we do have some patients in the autistic population that are taking this medication.
And what have the success rates been? Do you know the outcomes?
I don't know the outcomes particularly. I know that the physicians who are prescribing these for autism. We do a lot of the autistic population just from certain physicians in our area, and they're constantly writing for it. So I know that they probably have some really good feedback or results coming out of those cases where they're still prescribing it, for future fills and for more and more patients. So I think the patient cases and the outcomes are there.
Yes. Could you explain what interstitial cystitis actually is? Because I know there are many people out there who suffer with bladder problems.
Yes, ma'am. It is actually a condition of the bladder to where the gag layer in the bladder has sort of broken or is breaking down a little bit. There's we like to say little cracks in the gag layer of the bladder that's very painful when the bladder is expanded. So when it's expanded, you're getting, you have, it's full of urine. It's very painful. There's, those sodium potassium pumps going in and out, and really when the patient voids their bladder is when they get some relief, because that bladder isn't extended and outstretched so much. So it seems to have some sort of a possible autoimmune link there. It's still heavily studied, but one of the treatments, they've been using the Pitocin to kind of help with that bladder pain, and also bladder installations with hyaluronic acid and heparin and lidocaine and those types of things have also shown to help patients a lot with the pain relief in general, and kind of helping repairing that gag layer inside of the bladder.
Mm-hmm. I personally have MS, and occasionally I get spasms of the bladder, and it's like having cramp in your calf muscle but in your bladder, and it can sometimes last for like 5 months, and it's worse at night when I lay down, and when I walk it jiggles, the bladder jiggles, and it hurts. And the only relief you can have in the middle of the night when you feel you can't take the pain anymore is to sit in a warm bath. But then once you get out, it hurts again.
It's back.
Yes, it's back. Is there anything that you could recommend for people with that kind of a problem?
I know that it could be triggered by certain foods and spicy foods and that kind of thing, getting too hot. Those types of things seem to cause the flare-ups. But since it is so internal, just trying to treat it at the source. So in the actual walls of the bladder, we found has been most helpful for patients who are having so much pain, and just bladder installations and that kind of thing. I know it can be very difficult to either self-instill with catheters or to travel to the physician's office each time, but I know those patients are getting relief from those treatments and able to, function normally for periods of time before, it flares up again. So we tell patients, pharmacologically, it is hard to treat that particular disease state, but just staying away from spicy foods and, staying healthy. And I'm wondering now if LDN would have a place in that aspect, just for immune system health.
Well, I've been taking LDN for 14 years, but it still occurs occasionally. And I do like spicy food, but I don't have bladder problems every time I have spicy food, because I have spicy food at least every other day, I would say.
Yes.
So I don't know. I'll have to, when it happens again, and I hope it doesn't, I'll have to think back what I've done differently for it to have triggered it. Yeah.
I know diet plays a part in it too, and I've heard so many different cases of where patients will have different types of flare-ups, so it'll be for days or weeks or just a couple hours at a time, and I really see more women, of course, than men, but I have seen, a few men with it too. So I guess just even finding a physician who is familiar with it and current on the literature and the treatment regimens for it would be definitely beneficial for patients.
Yes, something to think about. So with your hormone replacement therapy, we've found that people on thyroid medications for like Hashimoto's or hyperthyroidism, hyperthyroidism, have to be careful when taking LDN because they tend to have too many, or the dose of hormones that they're taking is too high. The thyroid medications, they have to reduce it. Have you come across that in the pharmacy?
Yes, actually, we know that the thyroid, the adrenals, and the female sex hormones kind of all work together. They're in this big triad balance, and I've seen in the past just getting those particular organs and hormones all balanced is key. I believe the cortisol can typically be tested, on a 24-hour cortisol levels, and making sure that the adrenals are properly healthy and work and functioning to release cortisol properly is one step, and then getting the thyroid on track is another step. And then once those two are balanced and maintained properly, that's when you would really look at the hormone levels as far as, estrogens, progesterones, testosterones, and seeing if those are in balance for the female. So just having everything in balance typically is a good start. We've seen too as patients, start to feel better and even losing weight and maintaining a proper diet, that these levels will change and they'll need to be adjusted over time. One thyroid dose or one hormone dose isn't necessarily the end all be all of that patient. It definitely depends on how they're responding to treatment, how their lifestyle is changing, and for the better. Usually, you can, have patients are able to go down on their thyroid doses a little bit sometimes if their hormones are being properly balanced and they're getting their weight under control. And yes, that's definitely an option, getting their health back in order.
So if somebody comes to you that is overweight, and do you look at their height-weight ratio and to tell them how much weight they need to lose to get into a normal range, or do you look at the BMI, or both?
We typically look at the BMI here. We also are very symptom-based medicine, so we like to go based on, how the patient is feeling and really getting their weight on track in a healthy way. So just seeing what symptoms are they having? Are they thyroid related? Are they vasomotor symptoms related to hormones? Are they related to, any other prescription medications that they're on? So really just treating the root cause and finding out, everything about that patient as far as their medications are going and their hormone levels, and then what symptoms are they having? And in that case, in that instance, you would kind of recommend some weight loss regimens depending on that. So, if somebody has several pounds to lose, you wouldn't want to tell them to start running marathons the next day, because there's no way that they would be able to stay compliant or on track with those weight loss goals. So just having them start out, just like medicine dosing, starting low and going slow, and just getting out there and walking around and gardening or vacuuming the house can even help, with weight loss. So we try to go on BMI, but also what's reasonable for the patient.
Yes. And of course, if you were to go on some very strict diet that wasn't sustainable over time, and then you went back to eating how you had originally had been eating, of course that weight comes straight back on again. So you have to alter your lifestyle and your way of eating, and not looking at it as a diet per se, but as a new eating regime, isn't it? It is a lifestyle change rather than a diet. Something that, even if you lose weight very gradually, but something that you have altered your eating pattern so that the weight doesn't go back on.
Right, right. So just, maybe choosing smaller portions, or, you know, eating one cookie instead of two is what I always like to say. Just little changes like that can help, slowly get you on the right track to where you feel like you're able to accomplish those goals that you've set for yourself. And also, just getting up and walking around. And I try to make recommendations to patients who want to lose weight, or to get, get some of their cholesterol down, or their triglycerides, just little things that are actually attainable by the patient. Nothing drastic. I don't want people to be turned off by it and stop stop their weight loss regimen, or just go back to eating how they were. You want to make it, as a pharmacist, you want to make it achievable for the patient.
Mm-hmm. And of course, once you start losing weight, that in itself gives you encouragement, doesn't it, when you begin to feel healthier?
Right, just seeing little changes and, saying, I can do this, and little by little gradually getting more energy, and just getting the wherewithal to get up and go. We like to help with that, and even complementary therapies like probiotics and multivitamins and vitamin C and those types of things that are, shown to be beneficial.
Mm-hmm. What would you say are the top 4 supplements that you recommend to patients? I know that everybody's individual and everybody's needs are different, but if you had to find 4 that would suit most people, what would they be?
Ooh, I like this question. I'm a very big advocate of probiotics. I think they're good from an immune system standpoint, a GU standpoint, even in children, adults alike. I think they help leaky gut syndromes and those kind of things. That would be one, probiotics. I'm kind of hesitant on vitamin D, but I love to recommend it especially if I know patients have told me that they've, don't get outside much, or they're always working in an office or something like that. Typically, vitamin D is very, very low in our working population. We have a lot of around here, so I like to recommend vitamin D, just low dose if it's not in their multivitamin already. I also like to recommend magnesium. I went to a conference about 4 years ago and learned that about 75% of the population is deficient in magnesium. And we know magnesium is a huge cofactor for a lot of the biochemical, pathways and chains that we have going naturally in our body. So to be deficient in magnesium would, definitely alter some of those reactions and as an enzyme, or as a coenzyme. So I like to recommend magnesium, and then of course it helps for sleep too. So that's always nice.
Doesn't it also help with cramps?
Magnesium does, yes. It does help with cramps, some muscle cramps and that kind of thing too. And then, I don't know, I guess my 4th would probably be some sort of definitely multivitamin, or something tailored specifically to the child or the female or the male. I know some of our male ones we really recommend more zinc and that kind of thing. For females, I love I3C and DIM for, female breast cell health and vaginal cell health. And for children, I think multivitamins work wonders. So I've seen it personally in my own children. When they're on a multivitamin, they seem more, attentive and active and go-getting, and then without it, they're a little bit more sluggish. That's just in my personal opinion, but I think it works wonders for people.
When you were talking about probiotics, and there are many on the market out there, how many millions or trillions of bacteria should we be looking at when we purchase?
I heard that you should try to find a probiotic that has at least 5 to 7 different strains.
Okay.
I guess that's just to kind of attack and prevent from all different angles, all different strains that are currently in the gut. And so I always look for one that's 5 to 7 strains. I know we carry one here at our pharmacy that has 6 strains, so I tell patients, this is a great one. It has 6 strains. It has, the Lactobacillus acidophilus is always a big one, the bifido, and I like to see those in there. I know with so many formulations out now, it's probably changed since those guidelines, but I know having that many strains is always a good first step if you're looking for a probiotic.
And are they expensive?
They can be, depending on which one you get. Like I said, some of the larger amounts of strains can be a little bit more, whether or not they have to be refrigerated. I don't know if that has anything to do with the cost, but they formulate them now to where they don't usually have to be as much. The bacteria are a little bit more stable the way that they're encapsulated, but they could be a little pricey. You want to make sure you get a good pharmaceutical grade probiotic, though. So you can actually find them in America. You can find them at your regular pharmacy over the counter, but you actually sometimes have to ask the pharmacist because they keep some of those in the fridge behind the counter. So if you don't see what you want on the shelf, ask the pharmacist if they have any over-the-counter probiotics in their fridge back there, because usually they do, and you don't need a prescription for them. They just have to be kept cold.
Okay. And do you have to take them every day?
Yes, they're usually recommended to take daily. I know we do a vaginal probiotic here at our pharmacy. It is a cream that's used vaginally. That's typically done daily and then 3 times weekly thereafter, after about a month. So that one, I guess, is acting directly within the vaginal flora there at the site, and does not have to be taken daily. But the ones orally, I think you should be taking them daily.
If not, you're just fleshing them out, aren't you, really?
Right. I think it's best to keep that flora in your system at all times, the balance there.
Well, we've come to the end of the show, and thank you very much for educating us today. It's been a learning curve. Thank you. So,
I hope so.
If people would like to contact you at the pharmacy, what number do they call?
All right, we have a local line. It's 770-421-1399. We also have a 1-800 number. It's 1-800-517-5509. And you can also go to our website. It's www.innovationcompounding.com. And we can answer any questions there online. We have a contact your pharmacist section. They can type in their question, and it goes straight to the pharmacist team, and we answer those as they come in. So it's 2 good ways to get in touch with us.
Well, thank you very much for having joined us today. I really appreciate it.
You too. Thanks, Linda. I really appreciate everything you guys are doing.
This show is sponsored by Innovation Compounding, who are a PCAB accredited sterile and non-sterile compounding only pharmacy, licensed to ship throughout the United States. They commit to individualized pharmaceutical care and personalized medicines, compassionate towards patients and doctors, as well as being a wellness advocate for their patients' lives and state of well-being. Call toll-free 800-547-1399 or visit innovationcompounding.com. Any questions or comments you may have, please email me, Linda, Linda, @ldn.org.uk. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.